Hi, I'm Dr. Kamal from Fire Sports. So today what we are going to discuss is about the muscles around the knee joint. Knee joint has the upper compartment which is formed by the femur bone, the upper bone, or the lower bone, that is the tibial bone. Muscle attachment, we'll discuss about the hamstring. Hamstring is a muscle that is attached at the posterior aspect of the knee. So how to stretch the muscles? But before stretching, again I'll say the same thing, you have to go in for the releases. The muscles have to be released. We have to understand this. For what purpose are we doing? What joint we are going to offload? If we want to offload the knee joint, the direction will be towards the knee. If we want to offload the pelvis area, the direction will be a little upside. So coming up for the stretching, it's a simple stretch. You just easily has to bend the leg. Now when you do this, what happens? The pelvis gets rotated and the patient it starts to lift their sacrum and the pelvis part of the other side. So you just need to block the leg with your other leg, place the foot on the shoulder, straighten this, and gradually you have to increase the range. It will depend upon the tightness of the muscles. You have to understand, if the patient is suffering with PIVD, you have to avoid these stretchings. There could be, to mobilize the nerve, there are other techniques, but for stretching like this, if there is PIVD and that to acute case, you have to avoid these kind of stretchings. Now this can be performed by the patient themselves. It can be done by two ways. Please, ma'am. One way is very simple. The patient is asked to come close to the wall and lift their legs. Now with the support of some band or some strong resistance tube, will be elastic. I'll say some rope or something like this. You'll have to apply on the upper segment of the foot. Ask the patient to hold this, straighten the leg and try to pull it on their side. Now they'll feel the stretch at the hamstring level. This is one stretch which they can do. The other stretch which they can do is, ma'am please this side. It's a very simple stretch. In this case what happens, you don't have to bend your spine. You just have to relax. You can take support of the wall if you want. And put the leg down here. Yeah. The upper portion has to be relaxed. It does not have to be bended. See what happens, sometimes patient with low back, we have to release the muscles and we don't want them to come forward like this. If they don't have any back issues, definitely they can bend forward to grasp more stretch. But if they have any back issues, ask them to have an upright posture. You can increase the things from the here. Give me a support like this. A black. That cushion support. Huh? Yeah, fine. Now, if you want to increase the stretch, you can just place some other object that can easily lift up the leg. So this is how you can provide the hamstring stretch. Thank you.